President Biden.
8% over the past 6 weeks. Over the past 2 weeks, most of the country has improved as well. Case rates are declining in 39 states, and hospital rates are declining in 38 states. We're down to 66 million, still unacceptably high number of unvaccinated people from almost 100 million in July. That's important. It's important progress. But now's not the time to let up. We have a lot more to do. We're in a very critical period as we work to turn the corner on COVID-19. First, we have to do more to vaccinate the 66 million unvaccinated people in America. It's essential. The vaccine requirements that we started rolling out in the summer are working. They're working. The Labor Department is going to soon be issuing an emergency rule for companies with 100 or more employees to implement vaccination requirements among their workforce. Every day, we see more businesses implementing vaccination requirements, and the mounting data shows that they work. Businesses and organizations that are implementing requirements are seeing their vaccination rates rise by an average of 20% or more to well over 90%, the number of employees vaccinated. Let's be clear. Vaccination requirements should not be another issue that divides us. That's why we continue to battle the misinformation that's out there. And companies and communities are stepping up as well to combat the misinformation. Southwest Airlines, at the head of the pilots union and its CEO, dismissed critics who claim vaccination mandates contributed to flight disruptions. School board members, religious leaders, and doctors across the country are fighting misinformation and educating people about the importance of vaccines. All of these efforts are going to help us continue moving the dial to eliminate this disease. Second, we're going to continue protecting the vaccinated. This week, the Food and Drug Administration and the FDA is reviewing data on Moderna and Johnson & Johnson boosters. We expect a final decision from the FDA and the Centers for Disease Control and Prevention, the CDC, in the next couple of weeks. If they authorize the boosters, which will be strictly made based on the science, that decision will be based on the science, this will mean all 3 vaccines will be available for boosters. Already, more than 1 out of 3 eligible seniors have gotten their 3rd shot, the booster. And we're going to continue to provide that additional protection to seniors and others as we head into the holidays. These boosters are free. I'll say it again, they're free, available, and convenient to get. Third point I'd like to make. We need to continue to keep our schools and our students safe. 96% of school districts are fully open with children back in the classroom and for in-person learning. We have been able to do this because we provided our schools the resources they need to protect children and the educators, as well as the staff that works in the schools. We've been encouraging schools to implement important health measures like masking, testing, and getting everyone vaccinated who is eligible to be vaccinated. Now, I know parents out there are anxiously waiting for a vaccine for children ages 5 to 11. The good news is the FDA and outside experts from the CDC are set to make its determination as to whether the vaccine will be authorized for that age range in the next few weeks. If authorized, we are ready. We have purchased enough vaccines for all children between the ages of 5 and 11 in the United States. And it'll be convenient for parents to get their children vaccinated at trusted locations, and families will be able to sleep easier at night knowing their kids are protected as well. Let me close with this. The plan I laid out in September is working. We're headed in the right direction. We have critical work to do, but we can't let up now. My team and I are doing everything we can, but I'm calling on more businesses to step up. I'm calling on more parents to get their children vaccinated when they are eligible. And I'm asking everyone everyone who hasn't gotten vaccinated, please get vaccinated. That's how we put this pandemic behind us and accelerate our economic recovery. We can do this. I've said many times, God bless you all, and may God protect our troops. Thank you very much.
President Biden with a brief update to the nation on the status of the White House administration efforts to deal with the coronavirus. I'm going to bring in our chief White House correspondent, Nancy Cordes, who, of course, joins us from the North Lawn. Nancy, the president said we are entering a critical period. He also talked about this coming Labor Department emergency rule, which he said would be a vaccine requirement, not a mandate. He didn't use that word, and he said that shouldn't divide us. But the White House knows better. It has, and probably likely will continue to. Yes?
Right. I mean, they're able to avoid using the word mandate because what this rule is going to say is that companies can give their workers an option to either get vaccinated or submit to regular testing. And because there's that testing out, the White House insists this is not a mandate. Nevertheless, there are attorneys general from about 24 states, red states, who are already threatening to sue the administration over this rule. You saw the Texas governor try to preempt the rule this week by releasing his own executive order saying that any large business that tries to meet the new administration requirements when they come out is going to be fined by the state, creating quite a lot of confusion in that state. So there is a lot of debate over these rules. But what the president was arguing there is that, he's waited for a year and a half. He didn't believe in mandates at the beginning, but feels at this point in the pandemic that there are still too many people who haven't gotten their shots.
Nancy, before I let you go, it was a dismaying summer for this administration dealing with the coronavirus. Does it feel there that advisors and those on the coronavirus panel advising President Biden are feeling somewhat optimistic going into the fall, or are they still quite nervous?
I think they're very relieved to be on the other side of this Delta bell curve, feeling that they are not in the thick of it the way that they were earlier in the summer. But they've been burned once by the president going out there and saying, it's Independence Day here in America from the vaccine. We're on the other side, only then to see the numbers go back up again. So I don't think that that is a victory party that they're going to be holding out loud this time around. They know there's always a chance there could be some other variant that ends up pushing the numbers back up again.
Nancy Cordes, our chief White House correspondent on the North Lawn, thank you so much. I want to bring in our CBS News medical contributor, Dr. David Agus. Dr. Agus, your reflections, response to what you heard from the president?
What this was a summary of where we are. Nothing new, nothing dramatically changing, but a summary of what has happened and what is going to happen. And I think the key point here is that we're not out of it yet. And I think the president was sure to make that we have slightly increased in the vaccination rate. The pushing the companies to vaccinate employees is coming, which will increase it further. And the big step is children age 5 through 11, which means 28 million more people will be eligible for the vaccine in the United States.
Dr. Agus, I want to talk to you about something that if those in our audience are receiving phone alerts on their news feeds, they might be hearing about the possibility of an FDA commissioner being appointed by President Biden. That position is still vacant. What's the importance of that vacancy? Let's not get into the names because we haven't confirmed anything yet, but explain to our audience why a permanent FDA commissioner matters, why it's taken so long, and your thoughts on the overall process.
So Janet Woodcock is the acting commissioner now, and by federal law, it can only be for a certain period of time, and there has to be a new commissioner named by mid-November. She can't be as aggressive and as tough as she needs to be. She's a career FDA employee. Until she's full commissioner. And there's some people who are against her being full commissioner. At the same time, there are 2 other leading candidates the president is considering. And certainly the hope is we can have somebody who can provide the leadership we need with the new monoclonal antibodies for the immune suppressed, the new oral pill for COVID-19, and some of the newer boosters. And what we're talking about is children for the vaccines. We need real leadership at the FDA to make sure it happens as quick as possible for the American people. So the rumors are is that today, tomorrow, we're going to hear about a full FDA commissioner.
Very good. Our medical contributor, Dr. David Agus, we thank you so very much. Our coverage, that's a good word, coverage continues on our 24-hour streaming service. That's CBSN. You can watch it at cbsnews.com or download our CBS News app on your cell phone or your connected TV. We want you to know there will be more on your local news and tonight on the CBS Evening News. This has been a CBS News Special Report. I'm Major Garrett in Washington. Good day.
For news 24 hours a day, go to cbsnews.com.
That was a CBS News Special Report. Welcome back to CBSN. I'm Tanya Rivero. House lawmakers are expected to question two allies of former President Trump's today about their alleged roles in the January 6th attack on the U.S. Capitol. The House Select Committee subpoenaed former White House Chief Strategist Steve Bannon. However, he is refusing to cooperate. His lawyer is citing executive privilege. The panel also summoned former Defense Department official Kash Patel. For more on all of this, let's bring in CBS News congressional correspondent Nicole Killian. Hi, Nicole. So